Hello and welcome to our channel. Today we're diving into an important and widespread health condition, diabetes mellitus, commonly known as DM. We'll explore what it is, its causes or risk factors, how it's diagnosed, and the management options available. Diabetes mellitus is a chronic metabolic disorder characterized by high levels of glucose in the blood. This occurs either because the body doesn't produce enough insulin or because the body's cells become resistant to the insulin produced. Insulin is the hormone responsible for regulating blood sugar levels, ensuring they remain within a healthy range. There are two primary types of diabetes mellitus: type 1 diabetes, an autoimmune condition where the body's immune system attacks and destroys insulin-producing cells in the pancreas. This type often develops in childhood or adolescence, but it can occur at any age. Type 2 diabetes, a condition that typically develops in adulthood, though it's increasingly seen in younger people. It occurs when the body becomes resistant to insulin or when the pancreas cannot produce enough insulin to maintain normal blood glucose levels. Let's break down the factors that contribute to the development of diabetes mellitus. Genetics. Family history plays a significant role, especially in type 2 diabetes. If a close relative has diabetes, your risk increases. Obesity. Being overweight, especially with excess fat around the abdomen, is a major risk factor for type 2 diabetes. Fat cells can cause the body to become more resistant to insulin. Sedentary lifestyle. Lack of physical activity contributes to weight gain and insulin resistance, increasing the risk of type 2 diabetes. Diet. A diet high in refined carbohydrates and sugary foods can lead to weight gain and insulin resistance, thereby increasing the risk of diabetes. Age. While type 1 diabetes can occur at any age, type 2 diabetes is more common in people over 45. However, younger individuals are increasingly at risk due to lifestyle factors. Other medical conditions such as hypertension, polycystic ovary syndrome, and high cholesterol can also increase the risk of developing type 2 diabetes. Ethnicity. Certain ethnic groups such as African, Hispanic, Native American, and Asian populations have a higher risk of developing type 2 diabetes. Diagnosing diabetes. Mellitus involves several key tests. First, the fasting blood glucose test measures blood glucose levels after an individual has fasted for at least 8 hours. A level of 126 milligrams per deciliter or 7.0 millimoles per liter or higher indicates diabetes. Next, we have the oral glucose tolerance test, OGTT. After fasting, the patient drinks a sugary solution, and blood glucose levels are measured at intervals. A level of 200 milligrams per deciliter or higher at 2 hours post-ingestion indicates diabetes. Then, there's the glycated hemoglobin, HbA1c test. This test reflects average blood glucose levels over the past 2 to 3 months. An HbA1c level of 6.5% or higher indicates diabetes. Lastly, the random blood glucose test measures blood glucose at any time of day without fasting. A level of 200 milligrams per deciliter or higher, along with symptoms of diabetes, suggests the condition. Managing diabetes mellitus requires a comprehensive approach, including lifestyle modifications, medication, and regular monitoring. Let's start with diet. Adopting a balanced diet rich in whole grains, vegetables, fruits, lean proteins, and healthy fats is crucial. Limiting refined sugars and carbohydrates helps maintain stable blood glucose levels. Next, physical activity. Regular exercise improves insulin sensitivity and helps control weight. Aim for at least 150 minutes of moderate intensity exercise per week. For weight management, losing even a small amount of weight can significantly improve blood glucose control for those with type 2 diabetes. When it comes to medications, insulin therapy is essential for type 1 diabetes and sometimes required for type 2 diabetes. Different types of insulin can be used depending on the patient's needs. Oral medications for type 2 diabetes such as Metformin, sulfonylureas, and SGLT2 inhibitors help manage blood glucose levels. GLP-1 receptor agonists are injectable medications that help control blood sugar by enhancing the effects of incretins, hormones that lower blood glucose after eating. Blood glucose monitoring is also crucial. Regularly checking blood glucose levels helps patients and their healthcare providers assess how well the diabetes management plan is working. Lastly, regular health checkups are vital. Monitoring for complications such as retinopathy, neuropathy, and cardiovascular issues is essential in managing diabetes. Diabetes mellitus is a serious but manageable condition. With the right approach, individuals with diabetes can lead healthy, fulfilling lives. Early diagnosis and effective management are key to preventing complications and maintaining a high quality of life. Thank you for watching. If you found this video helpful, don't forget to like, share, and subscribe to our channel for more health-related content.